Greetings everyone. We are presenting a video on our innovation Morya's technique of Nucleus Hydroexpression in manual small incision cataract surgery, a novel technique to save endothelia and decrease intraocular pressure. The authors have no financial interest in the subject matter of this film. As we all are aware that endothelial layer is important as it allows leakage of solutes and nutrients from the aqueous humor to the more superficial layers of the cornea, while at the same time pumping water from the stroma to the aqueous. It functions on the pump-leak hypothesis. Also, it is a monocellular layer without any regenerating capacity. As all cataract surgeries leads to some degree of endothelial cell loss, and in manual small incision cataract surgery, it varies from 4 to 17%. There are many techniques of nucleus expression from the anterior chamber through the sclerocorneal tunnel in manual small incision cataract surgery. This small video is showing nucleus removal using wire vectors by placing it behind the nucleus and removing it with gentle inside-out movements. This is the Sudhir Singh's technique of nucleus removal using picofracture in the sclerocorneal tunnel. Nucleus of any sizes can be removed with a small size tunnel of 3.5 to 5 mm. This is the Dr. Sandhu Kruit's technique, in which after a large rhexis, Simcoe cannula is used to prolapse and remove nucleus from the anterior chamber. Many surgeons are also using OVD for nucleus expression in manual small incision cataract surgery by creating a positive pressure in the anterior chamber by pushing visco from the side port. The authors have developed an innovative Morya's technique of nucleus hydroexpression. In this technique, after prolapsing nucleus into the anterior chamber, a specially designed beveled up three-way Morya's hydrocannula attached to BSS Plus bottle is inserted behind the nucleus under direct visualization, and through sideways motion, nucleus is engaged in the sclerocorneal tunnel and counter pressure at the posterior lip leads to its expulsion. The curved angulation prevents any tissue trauma, and as there are 3 holes for fluid, 1 central tip and 2 holes on either side, so there is no anterior chamber prolapse. This is the design of Morya's 3-way hydrocannula with beveled up central opening of 0.7 mm and 2 side openings of 0.3 mm. This video is showing Morya's technique of nucleus hydroexpression. After routine temporal or superiotemporal incision using crescent and minimum cautery, sclerocorneal tunnel of 6 mm is made with good side pockets. Side cuts are given if nucleus is of large size. A large capsular axis of 5.75 to 6 mm is made using the cystitome after staining the anterior capsule, which is followed by proper hydrodissection and delineation till the nucleus is freely mobile. As you can see, it is a large nucleus prolapsed into the anterior chamber. Positive pressure is created by gently pushing BSS solution from the side port. Then Morya's 3-way hydrocannula attached to BSS Plus bottle through the drip set is inserted behind the nucleus under direct visualization, and using sideways motion, the nucleus is stuck in the sclerocorneal tunnel and removed by applying counter pressure at the posterior lip of the tunnel. The nucleus of such a large size is hydroexpressed quite easily. This is followed by meticulous cortical removal and placement of PMMA posterior chamber intraocular lens in the capsular bag. This is another video showing this technique in a hard intermittent white mature cataract with shallow anterior chamber, low endothelial cell density and hazy cornea. After a 5 mm capsular axis, few small nicks are given to prolapse such a large nucleus into the anterior chamber. Then the nucleus is effortlessly removed through hydroexpression using 3-way cannula. To assess the safety and efficacy of this technique, we did a randomized clinical trial by dividing 204 patients of manual small incision cataract surgery between group 1, in which nucleus was removed using OVD, and group 2 using our technique of nucleus hydroexpression. The results were as follows. At day 30 and day 90 post-op, there was 9 to 9.75% endothelial cell density loss in group 1 and only 4.6 to 4.8% endothelial cell density loss in our technique with a significant p-value. There was a decrease in intraocular pressure of 8.7% in OVD group and 7.5% in Morya's technique on day 90. So, this shows that manual small incision cataract surgery also leads to decrease in intraocular pressure, just like phacoemulsification. A recent article reported acute shortage of OVD in the market, so we need to look for alternatives and various surgical steps. Morya's technique of nucleus hydroexpression is a safe, repeatable and endothelia-friendly methods in manual small incision cataract surgery. Manual small incision cataract surgery leads to decrease in intraocular pressure that was sustained till 18 months. These are my acknowledgements. Thank you so very much.